And we'll get started. All right. So today we are going to be talking about disc pain, disc health, and all the fun things that are associated with discs. I know that this is something that literally we could spend a weekend and more on, as this has been a focus of what I have trained on now for some years. So we're going to try to wrap that up in about 15, 20 minutes into like some of the focal points so that we can really take some steps in your day-to-day life and feel better. So the first thing, we get a lot of general like questions, comments, thoughts on, like the basics of what is a disc, what are x-rays and MRIs mean, like what are the ways we can treat or heal them, and asking just like generally, why does it hurt so dang much? Why does it take so long? Like why do we have such a potential loss in our functionality when we're dealing with these injuries? And so we want to leave behind some old ideas around discs. They don't slip. They are tough as nails. They are strong, and they're slow to heal. And that's the challenge when they get hurt. And ultimately, you're not your X-ray or MRI. And when we talk about some of the statistics around bulges and herniations, that becomes so important. Because they can sometimes give us a belief that we have become something like a herniation or a bulge, or that's where our pain's coming from. And sometimes it's just not. And so we also want to talk and think about degeneration or arthritic change in different ways. Ultimately, I want to make sure that you start to trust your body and have tools and resources available so that you can continue to feel better and heal. Because this is something where, from the very start, I will say this can be a long haul process for some of us with significant injuries to those tissues. So the first thing we want to talk about here is a little bit of the spinal anatomy. When we look at a disc primarily, we're looking at both the annular fibers here that are concentric rings that are tough, and then this inner core, the nucleus pulposus. The outer and the inner are essentially made of the same materials, but one has more water in it, the inner, as one, and then the outside, the annulus, has less. Now, as you can see my little pointer here, I want to point back here. This anatomical chart doesn't show well here the ligament that it does right here. This ligament is what often will drive disc injuries to the back and to the side, which we will talk about some of the normal presentations, because this will stop it from going right into the spinal cord. You usually see these injuries go off to the side and then affect these nerve roots, which we will get into and chat about more here in a second. The annulus is the largest structure in the body that does not have a direct blood supply. Pressure is what brings fluid, nutrition, and waste management into spinal health. And so when we are dealing with weight bearing versus non-weight bearing, that's what's going to affect how a disc rehydrates and eventually heals. When we look at a normal disc, just like the last picture, we see these nice outer rings, the soft center, the spinal cord behind, and the nerve roots behind that. When we start to see a bulge, what'll happen is this, with repetitive movements and trauma, you'll see these little lamellar or concentric rings delaminate. And as they do, they start to separate, will inflame, and that's enough in some people to cause pain. But as that continues to warp and break down, that inner core of the nucleus will start to push out and put direct pressure not only on that nerve root, but can cause just local inflammatory change. The tissue in the middle of this disc has never seen our immune system. And so when it starts to get exposed, one of the pain generators that people will deal with is the inflammatory response that your immune system is going through to try to get this tissue to heal, but that swelling can cause a great deal of pain. Now, the progression of a bulge is a herniation where instead of these concentric rings just being pushed out, they eventually break and allow this center tissue to come all the way out and put direct pressure into the tissues locally. And we will talk more about that in just a second. So the first of the big three that we deal with is degeneration. Disc degeneration is normal. Just like me having white hair in my beard and white hair on my head, I am losing that pigmentation. I am getting wrinkly. I am 42. At 40%, or at 40 years old, 40% of us have degeneration. It is a normal process of aging. And so just because we've had an x-ray that says you've got disc degeneration, don't let that be a fear. It is something where just because it started to change as you've aged does not mean it's generating pain. It doesn't mean it's going to limit you. And in fact, most people will go through their whole life never experiencing any pain associated with degenerative change, other than me having to accept the fact that I don't look as good as I once did because my face is starting to get older. We have 80% of us are dealing with degeneration. But think about it. By then, your skin has changed, your blood vessels have changed, your body changes as time goes on, and it's a normal thing. The great news about even significant degenerative change is that only 10 to 20% of people are completely unresponsive to conservative care. Typically, this is not going to be an injury that will cause much for radiating pain, because when it hurts, it's this tissue right at that disc and bone junction, the end plate, that is generating irritation. Sometimes at the end of the bone here, it'll start to grow fingers between. More or less, the body's trying to fuse the joint if it becomes degenerative enough so that it can spare the tissue at the nerve root here. And so if you've ever heard the term stenosis, that can be one of the side effects of advanced degenerative change. But mostly, this is something that we see a great deal of in the office. And through conservative management of chiropractic care and exercise, you can get some really great results. The disc bulge is the other one. Now, we've all seen this picture of the tire where that outer rim or the outer layers start to let the air pressure push through. This is a perfect example of a bulge. More than 50% of adults have asymptomatic bulges. This is so critical, because if you go in for an MRI and you are told you have a disc bulge, we don't know if that's causing your pain. And ultimately, that is such a big, important thing, is that we have to rule out conservatively, do you have an injury that is treatable before you start to get into aggressive or advanced pain management techniques? Because often when we get away from conservative, we get into things where we're talking about injections and surgeries, which have side effects. And I'm not saying that those aren't needed in some cases, but if we can avoid them as long as possible and hopefully never need those kinds of interventions, your tissues will be stronger and you'll have a higher quality of life in most scenarios. This is something that is more common in men than women. Once you have a bulge, if you're not taking care of it appropriately, you typically will have flare-ups. These are very, very responsive, typically to directional preference exercises, but more importantly, we should be able to, in any bulge scenario, in any herniation scenario, develop strategies so you know exactly what symptoms and what movements are going to make you worse. And once that happens, it gives you a power to make a decision on whether or not you're going to choose to do an activity because of the potential pain that it could cause. Now, in passing here, there's a concept of the virtual surgery that Dr. Stuart McGill talks about. And the idea here is that, let's say you had a bulge or herniation and you went in and they said, okay, surgery is what we're going to do. So you say, okay, let's do it. Your next 12 weeks, you're going to be very low activity. You're not going to lift, carry, push, or pull anything. You're going to have assistance with walking for the first few weeks. And as time goes on, maybe by month 4 or 5, you get a 5 to 10 pound weight restriction. Maybe by month 6, you're up to 20 or 30. And from there, you start to add more and more over time. The idea here, though, is that if you just said, all right, I've been diagnosed with a bulge, or I've got this disc injury, I'm going to take 6 weeks, 12 weeks, and really, really take care of myself, taking the pressure off these tissues and allowing them to heal. I'm going to avoid doing things that clearly make it mad. I'm going to get advice on how to manage this tissue. And if we can do that, most of the time, these symptoms can resolve much faster with a much better outcome. And that's where, things like us, chiropractic, what we do at the office with a combination of physical therapy techniques and other exercise techniques, we try to put a cocoon of like, okay, here's what to do, here's what not to do. Herniation. This is typically more severe, but again, these can be asymptomatic. As crazy as that sounds, herniations can be asymptomatic. And so we don't always associate pain with a herniation, but typically if we are getting things like radicular symptoms where you have pain that's radiating into your arms or into your legs, things like sciatica may be a culprit when it comes to a disc. These are often much more painful because, as we can see in the tissue here, when those lamellar rings break and that disc tissue starts to come out, it can be quite painful because of the direct pressure on the nerve roots, the inflammatory experience of the immune system. But the good news about this, yes, is good news, is that most, as in 80% of these self-resolve in 18 months. Where most people get into trouble, though, is that the first few months can be quite painful. And sometimes the symptoms are red flag enough where you can't wait. So if you're ever dealing with this kind of pain where you're having it shoot into your arms and legs, the further down it goes, the more severe it is. So if you're having pain out of your back into your hip or your groin, that's a few inches. It's not good, but it's not all the way down to your knee or to your foot. Or conversely, in your arm, if it's coming out of your neck and just into your upper shoulder, it can be quite painful, but it's better than having it go all the way down your arm to your hand. Red flags, if you should ever be dealing with this, is abrupt changes in strength. Like if you cannot hold things, if you cannot lift things, if your foot slap on the floor, changes to bowel or bladder, those are serious and should be checked out immediately. Do not let them go because you can permanently damage nerves. Excuse me. The other positive around disc herniations is that, again, they are typically very responsive to conservative care. In all of 2019, we had 3 of our severe disc patients that ended up with surgery. And in 2020, we only had 2. And so we're not talking thousands and thousands, but out of 200 people that came in, and probably 50 or 60% of those, so 120 to 140, I would expect only 1 or 2 to have a progression to a point of surgery. And so the conservative options that we have, these are things that we see in the office and that we use in the office that are currently evidence-based standards of care when it comes to disc management that we're going to go through and talk about here, because ultimately, I want you to understand what we do or what you would maybe look to do in other cases when you are trying to manage your own disc pain. So the first thing we're going to chat about, and if you've watched any of our videos this month, we've been talking about the McKenzie Method. This has been completely like one of the biggest game-changing educational experiences I've had in the 11 years I've been out. There are certain things that I've learned about that have changed how I approach things, but the McKenzie Method is something that has a direct impact on me being able to say to you within just a couple of visits, yes, this is likely a disc, or this is likely, soft tissue, or this is something else. But the power of that is that it gives me an ability to teach you like an exercise that is not just like a stretch, but actually a self-treatment. You can't live in the office with anyone 24/7, and you should never have to. But when we can have a tool that directly treats the injured tissue, then we can start to have big change. And so the whole idea behind the McKenzie Method is it's repetitive movements or sustained movements that take that disc or that joint and recenter it and allow it to get back into a position when it can heal and actually go away. And so the analogy that I've loved ever since I saw it is 2 things. So if we take a jelly donut and I put it between my hands and I squish one way, that jelly is going to start to come out. Now, if I squish it the other way, hopefully I can start to bring some of that jelly back towards the center. Now, when we talked about the annular fibers and the nucleus at our previous slides, that same concept applies where if we start to put the same kind of movements, we can maybe start to push that tissue back towards center and allow it to heal. And if you can think about, if I cut the top side of my finger here, if I keep bending that in a way that opens that cut up, it's going to be really, really hard for it to heal. But if I start to keep it flat or even go so far as to bring the tissues closer together, it's going to heal much more effectively. And so the McKenzie Method for us in the clinic is often a day 1 approach to dealing with any kind of nerve or potential disc issue, because it is something that you can leave with having a very powerful tool to get better. Chiropractic care. is, obviously I'm a chiropractor. Yes, I'm going to recommend chiropractic care. But the great news is that there is a ton of good evidence around chiropractic adjustments and the effect they have on helping a disc to heal. When we improve range of motion in tissues that have been limited through inflammation or pain, or changed by the pressure in the area, we allow the body to work in its best state in order to heal. We are designed to move. And when I lose that ability to get in there and move tissues around, I am going to slowly start to degenerate or increase my speed of degeneration. I am going to lose strength in the tissues. We start to have what we call fatty infiltrate into the muscles around the tissues, which ultimately makes you weaker faster. And so chiropractic adjustments allow for the reclaiming of good, healthy motion. And when we combine that with things like the McKenzie method, so you can go home with improved range of motion and do an exercise that complements it, it just gets you better results faster. Soft tissue therapy. I love this. It's a great way to control pain, but the key to this, and I want to talk about stretching specifically. Just as we talked a moment ago about the jelly donut and certain pressures causing that jelly to move out and others to bring it in, some stretching is not good when you have a disc injury. And we're going to talk about this for a second because 80% of disc injuries are what we would put into the posterior or posterior lateral compartment. And all that means is that when I squeeze that jelly, it's typically going out the back or to the side. And when that happens, the last thing we want to do is push it out further, which is why you sit in a soft chair, you sit for too long, you slouch, you try to repetitively touch your toes or bring your knees to your chest, or you bend over and you pick things up a bunch and your pain gets worse. It makes sense because you're pushing that jelly further out every time you do it. And so it is so critical that we develop strategies on what stretches to do and what stretches not to do. But when it comes to soft tissue, until we can get that disc pressure off at the very deepest level, soft tissue therapies are a great way to take the intensity of pain down. Because that nerve at the spine is compressed, it is telling the muscles to get really tight to protect it, and those get fatigued and irritated. It's where you get knots and sore and stiff. And so when we do things like active release technique, Graston, ISTM, cupping, taping, all of those are ways to stimulate the tissue and just take some of the stress off. It's like just a break. Now, it's not going to ultimately be the singular thing that fixes it. That's why we have to put a variety of approaches in place in order for you to get better. But it's something that is a critical element of you getting faster relief. Laser therapy is something that we've been using in our office for about a year and a half, but has been widely available in the sports medicine industry for about 30 years. Anytime you go into any of the professional sports at this point, they're going to use the device that we are using in our office. A high watt deep tissue laser allows that energy to penetrate to the tissue, stimulating the cells to reduce inflammation, improve pain response or reduce your pain, and actually improve your healing response. In the veterinary world, the great thing about the laser is they've done a bunch of testing on animals and can say it actually improves your rate of recovery and healing. Because those same tests have not been done with people, we can't outright say it, but the indications are clear. When we start using laser therapy, the tissues respond in a really positive way. I have seen this be a difference between someone who's had pain for 10, 15 years because of an old disc, having it gone and having it linger. It can be a very powerful tool for treatment of chronic issues. Traction and inversion is a technique that I get asked questions about all the time. We don't have traction in the office, but it is something for certain disc cases and certain degenerative cases that can be a powerful tool. The thing is that anything we choose to do, we have to make sure that it is the right technique at the right time, because certain times you would not want to do traction. It can actually make symptoms worse. Same with inversion. You don't want to go order a table off Amazon and then the next minute you're all the way upside down. Your body will not love you for it and it can get you in some big trouble. And finally, home exercise. These need to be specific. Just like I commented a minute ago, most lower back disc injuries are made worse by trying to stretch your hamstrings and touch your toes. And so what we want to make sure of when you're in the office specifically, or when you are with any practitioner, is that your exercises are specific to the classification of your injury. And all that means is that your practitioner knows what's going on, has said to you, don't do these things because they're going to make them worse, and then do these things because it's going to help. Now, let's say, for example, you've come in and I said, okay, you've got a disc injury and it's going out the backside towards the left. I'm going to have you do this exercise to treat it. And these 2 or 3 stretches or movements, I want you to stay away from completely. By avoiding certain things, you're going to give your body a chance to heal and take stress off. And I have said it a million times to people, if you go outside and you get a sunburn, on day 2, if you go back outside and get sunburned again, it's not day 1 sunburn. It's day 2's adding to the tissue stress. And if you do it again on day 3, it's not healing, not because day 1 sunburn was so bad, but because you keep exposing the tissue to irritation. It's not getting the chance to recover. And we have to treat these discs and any injury in that same kind of concept. Nutritionally, we look at a few different things here that I really, really love because, one, it's easy to do. It doesn't require more of your time other than a few moments, and it has true effect internally to help you heal out. So the first thing is omega fatty acids or fish oils. These have a very powerful anti-inflammatory effect, and if you look up the label on the back, you're going to see EPA and DHA. EPA in an anti-inflammatory setting, you want to look for something that's a minimum of a 3-to-1 ratio. I typically will dose this very heavily in acute cases because it's been a powerful tool in letting people have some relief. Collagen is another great resource for managing disc repair and recovery. The tissues that a disc is made of is essentially collagen. And so we want to make sure that we are using collagen with the substrates in it that are specific to disc tissues. It's why we like Dynamic Collagen Renew from Nutridyne. Protein requirements go up in any new injury, typically about 1.25 grams per pound body weight. And so if you hurt yourself, it would make sense that we are going to need resources to repair that tissue. Just like if we're doing a remodel on the house and you don't call up your building supplier and have 2x4s and sheeting standing by, you're going to be left in a slower project. Having protein available allows your tissues to repair. Anti-inflammatory approach directly, we like Herbalese, and just recently Nutrition Dynamic released a new version of Herbalese called Inflamese Plus. They have things like ginger, boswellia, turmeric, hops, white willow bark, all of these things to reduce inflammation and help you be more comfortable. They're safe to do at high doses and they don't typically interfere with things. And so it can be a very effective way to control pain. And then finally, CBD. I love CBD for inflammation and pain response in the people that it's effective for. And that's the key thing with CBD with anyone is you want to make sure you're getting dosed appropriately, which can sometimes be a little tricky, and also making sure it's effective for you. I know that everyone right now is talking about how great CBD is. And for a great deal of our patients, I've had wonderful results, but we don't want to be using something that's not working. And so we can talk about that in the office if you have questions, or at the end of this talk if you have questions. And then finally, we really appreciate you coming and watching today or following up on the recorded session. And so if you are willing to come into the office and take advantage of us, if you've never had a laser before, we're happy to do a free laser session with you. And we're happy to do a complimentary consultation on your disc pain. The McKenzie Method specifically, and how I approach movement patterns within our chiropractic practice, allows me to identify things pretty quickly and can at least give you an idea on like, hey, yes, you are a great candidate for what we do, or nope, you should try other things first. But at least then you know how to take action on something that may have been plaguing you for some time. And so when you call, just let us just mention to the team that you watch this Lunch and Learn, and we'll be happy to get you taken care of and set up for these great offers. Our upcoming events. On the 15th, we're going to be doing a health is sweet. So stop by during the day. You get a free body comp analysis. You'll be entered into your 10% off on your customized weight loss program. You do not need to be a current client to do this. Body composition analysis is amazing because not only does it tell us internally what's happening, the scale can be a distraction. Sometimes, and I think if you've ever tried this, you get dialed in on some food. You start working out really hard, and then you hop on the scale and you're up 3 pounds and you're like, what is this about? Having the body composition analysis will tell us why those pounds have come on. They'll give us detailed information about your metabolism, about your muscle mass, your body fat percentage, and all of these are critical tools in allowing you to get better results when it comes to getting your health back. And so we'd love to see you down here on the 15th, 8 to 5. Becky will take great care of you and make sure that you get your info and walk you through it. Then on the 23rd of this month, I'm going to talk again about disc issues and more specifically about the McKenzie Method and why it's such a powerful tool. And really, we're going to go over some basics on how to use it and some of your self-tests when it comes down to it. And so I, again, appreciate you all coming and listening today. I am going to open up the floor to any questions if there are any, and otherwise I'm going to have or wish you all a very, very happy day.
Seth, one thing that I'd like to mention is that our water bottles are available. And if you purchase one this week, you'll receive a free fruits and greens to go. So that is available also.
Perfect. Thank you, Kaylin. And I will make one brief comment about these water bottles. We were super excited. They've been sitting in the Los Angeles port for some time. And I'm looking forward to letting people have not only that great option for drinking on the go. It's a nice high quality stainless steel, so we don't have to worry about BPA or any other plastic compounds that can cause hormonal disruption. So as Kaylin said, stop in, check them out, and get your free greens. Otherwise, thank you for coming today. Thank you for listening if you're here on another day, and we will look forward to talking to you soon.